What are sinuses? The sinuses are air hollows, i.e. full of air, located inside the bones of the face, forehead bones and cheeks, and skull. These sinuses are connected to the nose and throat through small openings and are therefore in contact with normal air. Sinusitis. Sinusitis is the swelling of the mucous membranes of these sinuses. This inflammation is most often caused by a bacterial infection associated with an injury to the upper airways, nose, mouth, throat, such as a cold. Prolonged cold. It is by its usual definition a cold that lasts for more than 1 week, where the patient feels heavily in his head and nose and is forced to snore and his voice becomes relatively nose and needs to cough sometimes, and headache in the head, especially in the position of bending forward, and the pressure in the vicinity of the eyes and below, is painful, and the patient is infected with a fever. The mucous membranes that encapsulate the sinuses swell, and the openings connected to the nose are relatively blocked, and the secretions are thus confined to the sinus cavities. In short, all the factors that lead to high pressure within these cavities and the patient's pain combine. A cold may be associated with a bacterial infection that causes a patient to develop a fever, acute sinusitis. Do not delay the treatment of sinusitis. In addition to the discomfort this disease generates, there is a fear that it will become chronic, in which case the efficacy of treatment is reduced. Therefore, self-care must be taken care of properly. First, there are easy ways to empty the sinuses of secretions, such as good sinus, washing the nose with hypertonic solution such as water spray, salt or otherwise, or taking medications according to a doctor's prescription. When the sinuses are emptied of secretions, the pain dwells. In the majority of cases, antibiotics may have to be taken to fight bacterial infections. Antibiotic treatment must be completed to the end, i.e. for at least 5 days, even if it seems to us that we have recovered from the disease. Like every bacterial infection, you have a risk of recurrence if the sinuses are not fully cleaned. Sometimes sinusitis also causes significant pain in the form of blows or pulses, with the difficulty of emptying the sinuses with sinus snouts. In this case, you have a fever and a graduate may appear inside the pocket. Therefore, quick procedures for emptying the pocket should be taken to prevent the infection from spreading to neighboring organs. In children. Children's colds often last between the ages of 6 months and 6 years, are accompanied by mucus and last days. This is normal, as children are in the process of building their immunity. However, the children's nose should be cleaned with a physiological solution, water and salt solution, or any other liquid, and get them to snooze the baby's snitch or with cotton sticks that we insert into the nose to stick to the mucus and then gently remove them. Children's colds are not dangerous but should be monitored. Infants under 6 months of age are often protected by the antibodies transmitted by the mother and rarely develop a cold. Chronic sinusitis. Chronic sinusitis is an inflammation that lasts for more than 3 months despite good follow-up treatment. It is important to undergo X-rays to find out the causes of sinusitis. Chronic sinusitis caused by infection. Antibiotics in cases of chronic inflammation are less effective compared to acute inflammation. The openings are chronically blocked, so it takes longer to treat and, of course, recovery is slower. This condition may require surgery to remove the secretions that clog the openings and empty the sinuses. Chronic sinusitis caused by allergies. Chronic sinusitis is not always caused by bacterial infection, which in turn affects the patient as a result of a viral infection, but can be attributed to allergies, in which case it is necessary to look at allergens and treat them radically through a move away from allergens or through immunotherapy.